Ladies and gentlemen, good afternoon. The session on investing in women's health will be beginning. Once again, thanks so much for taking the time to join us today. My name is Fifi Peters, and I'm a journalist. I'm a senior anchor at CNBC Africa, and I am delighted to actually be in your company for the next 45 minutes or so. If you will allow me to be frank, what I would like to also share about myself is that I am one of the worst people to be around during my premenstrual cycle. I am cranky. I suffer from anxiety levels and mood swings that go through the roof that as a result also take my temporary depressive state to the floor. Now, all my life, I thought that this, of course, was part of a premenstrual syndrome, PMS, or Eve's curse, as it's also known, but I have come to learn that that is not necessarily the case. In preparing to be with you today, I had to do a little bit of reading, and I learned that there is actually not a lot of research and not a lot of data and attention being paid to areas like PMS, and therefore not sufficient understanding. I did learn from a report that was released last year by the World Economic Forum in partnership with McKinsey Health Institute that, in fact, PMS is one of the areas that have a huge economic potential. Around 150 billion US dollars can be unlocked if more research and more attention is paid to this field. I also learned that, of course, it's one of 10 conditions that, if given a lot more scrutiny and a lot more attention, could unlock potentially $1 trillion US dollars for the global economy by 2040. And so the purpose of this session, ladies and gentlemen, is to build on the momentum that has been put in place and pushed forward by the Women's Global Health Alliance. It is also to reflect on some of the news that has been released to us today from the World Economic Forum regarding the release of the Women's Health Impact Tracking Platform. And essentially, we are here to understand exactly what the objective of this platform is and how it can contribute to a greater health equality between men and women. So without wasting any more time, allow me to introduce the speakers to you, who I am told are friends and no strangers amongst each other, and perhaps no strangers amongst many of you in the room. But for those of you who, like me, are meeting them today for the very first time, let's introduce them. Beginning with the lady seated right here on my left, Ms. Anita Zaidi, President of Gender Equality Division, Bill and Melinda Gates Foundation, also the co-chair of the board for the Global Alliance for Women's Health. Good afternoon, ma'am.
Thank you.
Also, let us please welcome Dr. Muhammad Ali Pate, Coordinating Minister of Health and Social Welfare of Nigeria. Thanks for being with us, sir.
Thank you.
And we have Ms. Catherine Russell, Executive Director for the United Nations Children's Fund. Catherine, good day. And last but not least, of course, Bernd Montag, CEO of Siemens Healthineers. So thanks to you also for your time. And so, Anita, I'd like for you to begin the discussion for us. I guess it is quite a simple equation to perhaps a very complex and comprehensive challenge, but a simple equation that more data means more knowledge, more insights, better health outcomes. But perhaps maybe you can set the record straight for us as to why greater data in this space is so important, and feel free just to reflect on some examples that have shown that more data has actually led to improved health outcomes, particularly for women.
Yeah, thank you, Fifi. So it's wonderful to be here and talk about women's health, passion of mine. I'm at the Gates Foundation. I've been there for 11 years, focusing on R&D. But for the last 4 years, I've had the pleasure of leading the Gender Equality Division, which has a very big focus on women's health and women's health R&D. And so one of the first things that I noticed when I took on this new portfolio of work is that the lack of data. Lack of gender data that informs why we should be caring about women's health, what the gender gap is, both from a impact perspective and a disease burden perspective, but also like clinical trials, R&D, animal research work. So just a whole spectrum of missing data that therefore is leading to consequences such as lack of investment in women's health R&D and lack of investment in health systems that serve women. And so we started thinking about like, how do you address this data gap? And one of the first things that we did was actually invest more in an institute that's called Institute for Health Metrics and Evaluation, or IHME. Many people might have heard. They work on global burden of disease. And we said, well, are you sure that you have the best data available for women's health and maternal health? And they said no. And they started then have been systematically looking at all of the conditions that are potentially high burden or potentially high risk for burden, and are correcting all of their. So the new GBD 2023 will just be out, and it's way different than what has previously been done, because it will have much more focus on gender disaggregated data and focusing on disorders that women suffer from predominantly. The other two investments that are really have been very inspirational in the outcome already. One is the Global Alliance for Women's Health, which WEF is sponsoring. And they are just today launched the Health Impact Tracker. So this is the, now you'll be able to tell for a certain number of diseases that are very high burden, what progress is being made year to year. So it's an accountability tool. And the other one is something that we had the privilege of partnering with US NIH a couple of years ago, called the Innovation Equity Forum, which looked across, so this was a grassroots effort by all sort of different sectors that might have an interest in women's health: public sector, private sector, industry, biotech, venture funders, patients, civil society organizations, all came together to develop a opportunity map for women's health research based on what the gaps were. And they put this out, and that's become viral. It's being used all over the world, and it is also fed into the work that the Global Alliance for Women's Health is doing. So these are ways in which we are trying to address the gender gap, and now we have much more data available than we had like 2 or 3 years ago.
So perhaps it might be a bit remiss of us to not reflect on maybe changes or progress that have been made. And I think particularly since the release of last year's report, the Closing the Women Gap report, that placed a figure, a value on the size of the opportunity here. It's a lucrative one. I'm no business owner or business person, but $1 trillion is certainly something that is a best case commercial case. Anita, to stick with you, ma'am, what kind of progress have you made in terms of interest, increased business activity, increased attention being paid to the space as a result of the commercial case being laid out on the table?
Yeah, so it's interesting that you asked that. So so the report that came out showed that if you invested in women's health, for every dollar that you invest, there's a $3 return, and that this is actually $1 trillion opportunity by 2040 if you invest in women's health. And we focused on the broad spectrum of diseases, but this year there is a new what I would call a sub-report out, which is the blueprint that focuses on 9 diseases that actually are very amenable to addressing right now, such as cervical cancer, breast cancer, hypertensive disorders of pregnancy, postpartum hemorrhage, premenstrual syndrome is in there, migraines, endometriosis. So these are, there's commercial opportunity here, but there's also huge impact opportunity for saving lives and improving lives. So the space, lots of organizations has joined the Coalition for Global Women's Health Alliance, and $55 million have been committed to working in this space. And then new things are happening. So, for example, there's going to be an champions activator network for maternal health. There is a clinical trials consortium that's happening around women's health that are all coming as products out of the alliance. And so it's very exciting, actually. And I was just in another conversation, and somebody, and it was not about women's health, it was about gender writ large, but somebody from the audience asked me this question: what's changed in the last year that we're hearing so much about women's health?
Sure.
And that just made my heart sink, like that, okay, people have noticed that we are talking about women's health.
Which is a good thing. And thank you so much for the report that actually has come out. Because honestly, prior to preparing for this session, I actually thought that during that time of the month, I lack self-control over my emotions. So thank you for making me feel a little bit better about myself. Mr. Patesa, Maybe you can give us a bit of a regional perspective from the African continent, where we have learned that women also suffer quite a significant amount of the disease burden, although interventions available for them are not as significant as their counterparts in more developed countries. What is the case looking like in Nigeria, sir? And how are you as an administration looking at tackling this challenge, sir?
Taking it from where Anita left,
Sure.
I think it's very clear this has been an underattended area in global health overall, across the spectrum, from adolescent health, reproductive health, maternal health, the burden of non-communicable diseases, cancers, mental health, across the board. And the data gap, the data disaggregation, the burden of disease, our understanding has evolved. And I think the crisis that we have, for instance, of maternal health, where we have 800 women dying daily from maternal causes, not a disease, is not as visible as it should be. For us in Nigeria, we had an ambitious agenda in terms of our health sector renewal investment initiative to start aligning and focusing our efforts towards improving population health outcomes. You can't get through that without looking at reproductive, maternal, newborn, and child health. So focusing on that, expanding our primary healthcare system, training our frontline health workers, more than 53,000 of them, thousands of primary healthcare centers revitalized, but also dealing with financial protection, because many women don't access services because they cannot afford them. Taking that barrier out, whether it's for reproductive health services, antenatal care, when they come to deliver, or emergency obstetric services, we're on a path to make that free so that women who are eligible can have those services. The difference between life and death for some women is affordability of things like cesarean section, mobilizing resources to be able to do that. The innovations that have been developed, whether it's postpartum hemorrhage therapeutics, the drapes that have been developed, hematinics, multiple micro, to ensure that women get them through the retail outlets. In addition to that, ensuring the governance of the sector, the performance, accountability, and the data systems are able to track that women are being served. We have People's Perception Survey to track that, so that we're responding to the needs of the population we serve, with women as part of that population. So using data to recalibrate what we're trying to do. But importantly, also focusing on the leadership of women in the context of our health system. If we really are to achieve universal coverage, to optimize our population, then I think women's health, not only on the delivery side, but on the crafting of the policies and the programming. We just launched a National Health Fellows, one health fellow per local government, young people, different sectors, to help drive accountability, to learn, but we're also organizing and I hope nurturing the next generation of health leaders in Nigeria to build this. And in that, being explicit that we need young women to step up, because in the health workforce, we have significant proportion of women, but there seems to be a glass ceiling in many areas that they're not able to break through. That will help bridge this perception gap, complement the data, the improvement that are necessary, so that we can truly achieve an inclusive health situation for our population, bring in the contribution of all facets of population. Another angle is the wider multi-sectoral aspect. It's not only the health sector. So for us, malnutrition, important, so multiple micronutrient supplements for mothers affect their babies and their children. Education, particularly in northern Nigeria, a key issue, key determinant, links to maternal health, links to immunization, because the zero-dose children and the maternal deaths are in mothers who are not educated. Water and sanitation, issues of menstrual hygiene, those are all important issues, including security, gender violence, and the law that is needed to actually protect women. So there are things that we do within the context of the Health Sector Renewal Initiative. But in the context of overall President's Renewed Hope agenda, there's a multi-sectoral lens as well, where other sectors also have to weigh in. at the end of the day to improve our population health outcomes. And we cannot achieve that if the women's health aspect is left behind.
No, thank you so much for shining or putting under the microscope, as it were, the importance of the multi-sectoral lens. And what I didn't hear enough of from you, sir, and forgive me if I've missed it, is the role that the private sector is playing in helping you to action your plans. I mean, I come from a country in South Africa whereby there is a common objective between the public sector and the private sector to achieve universal health coverage and increase the level of access and increase the level of affordability for those. I mean, healthcare should be a basic human right. So there's an agreement on where we're trying to go. There's a disagreement on how we get there. So maybe perhaps if you can just let us know how your private sector is working with you in trying to achieve the goals that you have stated out, sir.
The private sector provides roughly half of health services in our country. We have a mixed health system. That is the firms that deliver services. But beyond that, a third pillar of the health sector renewal investment initiative that we have is to unlock the healthcare value chain, to localize manufacturing, services, digital technology. So there's a whole slew of areas that private sector can come in, and government is providing incentive for market-tested, viable investments to contribute in delivery of services, because there's an economic value as well as societal value. And we are being successful in raising significant resources to localize manufacturing, and we're looking to do more, including for reproductive health commodities that can be manufactured locally in our country. That will give jobs to multiple of young men, young women in our country. So we have a view that the future of Nigeria's health sector is mixed. And there is a role for the private sector and private capital and innovation, but there's a role for public financing to guarantee access for everyone, and investments in primary healthcare in those arenas, and learning from the innovation in the private sector as well, so that we can stretch the public financing to go even further.
Okay. Coming back to you in a short while, but Catherine, maybe to get your perspective here, because coming into these meetings, we do know that there's a lot of priorities that our governments as well as the private sector are looking at right now and trying to navigate through. The geopolitics, the fragility of the economic recovery in some parts of the world. We also have issues related to climate that is also, it may be affecting some parts of the world a lot more than others, but we're all feeling the brunt of some of the risks around climate. And then on top of that, it's putting in and putting greater focus to some of the ailments that are important and are impacting half of the world's population. Equally as important, but how do you balance these competing risks and priorities, as it were? You have a bit of experience in this space from your portfolio at UNICEF. So maybe you can just talk to us about what the playbook looks like in trying to achieve a better balance here.
Well, it's interesting because in some ways this issue of women's health is so simple, right? Should women's health care be prioritized? Yes, and for all the reasons. I mean, Anita knows this and has explained it with the data. We know that in some ways it's simple, but the execution is really complex. And I think that, Minister Pate is doing such a great job at this. And I would say that UNICEF works in every country virtually in the world, and so we have a lot of experience dealing with different circumstances. The key is you do need to bring everybody together working towards the same objective. We know the objective here. The objective is to improve women's health. How you get there is complicated and challenging, and it requires government leadership. I really think that is the most important thing. In governments where this is a priority and they're committed to it, everyone starts to march in the same direction, which is incredibly helpful. It gives the opportunity for the private sector to come in, for the international organizations to be working in coordination with others, for the NGOs and the large organizations like Gates to come in. Everyone can move in the same direction. It is challenging for sure, and I think from the UNICEF perspective, our focus is two things. One, maternal health, of course, because healthy mothers have healthy babies, and we're trying to have healthy babies. And then also, we're really focusing on adolescent girls, and I think that's a place where we have seen a lot of entities come together behind the importance of this, recognizing if you don't get girls at that adolescent age and make sure that they stay in school, as the minister said, and also have healthy practices and have access to health care. We're working hard on an HPV vaccine and trying to make sure that's available to girls. If you don't do those at the adolescent age, you tend to lose those girls. And it is very hard to catch up. And then they become younger mothers, they have children, they're not healthy, their children are less likely to be healthy. So all of these things are related to each other, and it requires a multi-sectoral approach to really bring in everyone and be clear about what their role is and where they can fit in.
In terms of the leadership, though, just based on what you have seen in the many territories and geographies that you have observed in the space of women's health, how would you rate it in terms of the quality of leadership that you are seeing right now, and perhaps where are the areas that you are seeing for improvement?
Well, I'd say a couple of things. One is just, in my previous life, I did a lot of work on gender equality. Gender equality is an issue here, right? Women are not always treated equally in societies, and so their health care is not prioritized in the same way. It can certainly be a challenge, and I think it's something that we all need to pay attention to. And as I said, the leadership really does make a difference here. You've got to make sure that this is a priority, and that women's health is not seen as kind of an, oh, and by the way, let's take care of women, because the consequences of it are really profound. And I think, if we can get that message out, I think it helps for sure. It does vary, certainly, depending on where you are. But I do think that the international community does have increasing awareness about it, and that helps. Things like the WEF report, those help, right? Because it brings more attention to it. And when countries see that it is in their interest, which is ultimately the reality here, right? If women are healthy and can participate in their societies, the society is going to be more prosperous, right? If women are healthy and can participate, again, their children are more likely to be healthy and educated. But, these countries in many places are struggling with a lot of different priorities. They also are, in many cases, struggling with debt, where their debt sometimes, exceeds both their healthcare and education spending put together. So it can be very, very challenging for countries. And I think the key is to work hand in hand with governments to try to help them do better.
I can testify to the countries that are struggling with debt. I mean, Mohammed, we know that we come from a continent in which I think over half of the continent, in fact, is in debt distress, according to how the IMF does define it. And it does make for those, okay, what do you prioritize in terms of the budget?
So even if they want to, sometimes they just
even if they want to, which also speaks to the importance then of the collaboration with players who perhaps have more healthier balance sheets, as it were, Bernd. So perhaps maybe you can come in here with the private sector take on this right now.
So on the one hand, I can say I run a technology company, but a technology company in healthcare. Sure. And I consciously don't want to start with what's the technology solution to this, because sometimes technology is the hammer and then everything else looks like a nail. Yeah. So first of all, what we do is a transition, and I do a little bit of a caricature of where we started as a company, to be the provider of great equipment for specialists in developed countries. Yeah. So here is the oncologist, the radiologist, the lab director, and we have the best machine, and we are happy to gain market share. And we define success as how often do we win in the established world, so to say.
Sure.
The mindset switch, I think that is the real beginning of the effort, is to measure success in how many lives do we touch, to really define success as what's the patient impact, what are the patient touch points, and not part of your sustainability program because it sounds nice, but because this is really what you are into. And then you get very quickly to the topic of health disparity. And then you are also looking at what is the real topic. Yeah? It's the big difference whether, in another industry, whether you have a vaccine or whether people are vaccinated. So what needs to happen? And then we need to work our way back, think about what are the diseases, then what is the system in a country, who is there. I totally echo what you said about also who are women leaders in healthcare provision and how can we help building them up. This is educating them and giving them confidence. And this is what we, for example, do in collaboration with a NGO, City Cancer Challenge, But then also we need to challenge who we are, in our leadership, and we have our own program of now we have at least 30% female leaders in senior management. It's not 50, but it's much better than before, and on the top of the company it's 50-50. So I think that all is connected, and I think this is one super important aspect. How do you change the mindset to impact, and then you look at what are the diseases, and then you get to, okay, for example, there's cervical cancer, there's breast cancer, and 80% of the deaths in the world of cervical cancer or breast cancer are happening in the LMICs. What can you do about it? And how can you build capacity? How can you train your technologies better, but how can you make them more affordable? So then the technology comes as a solution, but not as the thing you start with.
Sure. I mean, you mentioned a very important point around the change of mindset. Sounds really simple, but perhaps more complex to execute. We take it from the animal kingdom. I believe is it a leopard or a cheetah? Leopard never changes the spots. One of them. Someone correct me. Feel free. But it's not an easy thing to do because the comfort zone does settle in terms of the status quo. Perhaps you can share from the experience over at Siemens just the playbook for transitioning into this mindset that you're talking about that perhaps can be exported into other entities.
See, I mean, one is, and I don't want to be too lofty, but I think, how do you express who you are?
Sure.
Do you say we want to be leaders in technology, or do you want to say we want to have an impact for everyone, everywhere? And what is the tone from the top? So I think that makes one big difference. And then we have done a lot in also establishing collaborations with the NGOs. We are working very well together with UNICEF, and we are learning a lot. I mean, we acknowledge that we learn. We have to learn a lot. I mentioned City Cancer Challenge. We are working with the Global Fund and so on. So to really understand what does it mean to be in a low resource environment, and what can we do. And then the next step is that we have to get over that hidden assumption that we come into play once the ecosystem is set up. When you have figured out education and reimbursement, and when there is a nice hospital, then we come with our shiny product catalog. That doesn't work. We need to engage in creating this, I mean, the term is overrated or overused ecosystem, but we have to take an active role. We have to form these partnerships. And that is also a topic one needs to actively promote in a company.
Okay, which we will. But I think it would be remiss of us to not talk about your shiny products that you do bring to hospitals and various entities. I mean, the theme of the meetings this year is looking at that collaboration in this intelligent era. So let's just talk about how much smarter these shiny products of yours are becoming, and your industry, just to set jokes aside, your industry in perhaps helping to solve some of the ailments, particularly that relate to women here, because I do know, and I know that many of you are going to touch on it, in terms of the kind of activity that we are seeing in the tech space, the likes of femtech and all of that are getting a lot more attention, perhaps not as much as could be the case, but there is that attention, as you did allude to as well. So just talk to us in your view as a technology provider, sir.
So I mean, on the one hand, it is very important that when you look at technologies which are serving or helping to diagnose or cure women-specific diseases, with breast cancer or cervical cancer as prominent examples. So how do you find technology which you can deploy in a low resource setting? How can you use AI to make, because sometimes putting the equipment is easier than having the specialist.
Sure.
So how do you use this? How do you use AI digitalization in order to deploy the technologies? And then I think the aspect of the bias, which is maybe in the heads of some trained physicians, you can overcome with better trained AI. I mean, by taking out the gender bias when it comes to other diseases and train your algorithm in the right way. When we do assay testing in lab medicine, we are not looking at humans, but we separate between what is the reference value in men and women and so on. So really deploy these new opportunities in technology development to be gender specific in the development.
And I'm wondering if each of you do have a view on technology and to what degree it can help solve for the gap that we're trying to close here. Anita, I asked, Bernd made a reference of the biases that perhaps the likes of AI can attempt to overcome or may overcome. And I'm wondering if it will help offset some of the biases that are set from when a lot of these medical professionals go to school. It was fascinating to learn that a lot of the study actually gets done with a male body as being the case example as opposed to the female. So do you think that AI and some of the inventions in the tech space can help offset those biases, or do you think that there is still a greater urgency that's required to get the curriculum future fit?
Yes, Fifi, so that's a real issue, bias in AI technology. And so we have to be very intentional about looking at this. And there is an opportunity now when everything is so new and we're building for the future, that in LMICs, we very intentionally make sure that the right data is there for the bias to not be there. And I think to a large extent with these agents that are being developed right now for, let's say, diagnostics. People are looking at this, making sure that there's enough women's voices. The large language models that are being used to develop the generative AI are, and Gates Foundation is part of this effort, making sure that women's voices and women's conditions are represented in these things. One of the use cases that we've been very excited about from the foundation that is using AI is in diagnostics and is obstetric ultrasound, which we're calling fetal wellness monitor. So you actually don't have an image, you're beyond the image now. And low-level health workers will have the power of the technology in their hand to be diagnosing many conditions in men and in women. Obstetrics, cancer, fibroids, things that right now don't get, gallstones that don't get diagnosed right now, will become primary healthcare diagnostics in the future, right? So I'm actually personally very excited about the potential for AI and potential for AI to be good for our in fact, I think the biggest benefit that we'll see of AI in LMICs will be in the health space. I'll also talk about a little bit, because I might not get a chance later on as we're running out of time, is the power of collaboration and coalitions, right? And so women's health is one of those areas when we, from the Gates Foundation, started looking at it, where a lot of good people were in the space, but they were not being connected, right? So people like Montag from Siemens, many other industry partners, venture funds, biotechs who do want to benefit the field, and academics who are like all working in silos. So bringing them together with government leaders, committed government leaders like Dr. Pate, in a coalition format has just been enormously transformative for the field. And I will always remember this, two women from Africa, from Kenya actually, who came up to me, who were midwives, right? And in this innovation equity forum that we had held in Washington, D.C., saying that they had just never been part of this conversation where they were being seen as part of a solution, right? Their opinion was being asked, what is it that women's health needs? What are the R&D needs? And similarly, patients, right? In this, we're including patients in these conversations, people who are themselves suffering and have an idea on what is it that they need for the solution space, which you mentioned, right?
Sure.
Yeah. So I think those are, that's something that I'm seeing very much, like we're all building this together, that we all are coming together in these coalitions and collaboratives to accelerate progress for women's health.
Catherine, I couldn't help but notice you jotting down some notes, and I wanted to know if you can't,
What were you writing?
if you care to share what notes you were taking.
Anita says.
Okay. She clearly struck a tone or a note within yourself in terms of what she did say. Perhaps any contributions that you have in that regard. When we're talking about the intelligent era and the technology, but Anita did also take us down the path of collaboration, and perhaps you've got any additions there.
Yeah, I mean, collaboration obviously is key to us, but I would say on the technology side, we're very excited about the potential of AI to help us in reaching the millions of children that we're not reaching right now with healthcare and with education. We're excited about it, and I think there is a lot of learning, and I think the key, it was interesting when you were explaining how, you need constant feedback, and I think that's what we are trying to engage with our partners on, and that's why this collaboration is so important, because you try something and you see how it works and you keep trying to adjust, and I think technology is really important for that it's a constant discussion to say, is this having the effect that we want? Are we reaching the children we want? Is this education module working or not? I would say the other piece of this, though, is that just a little cautionary note, which is that we also worry a lot about the impact of technology on children. And children are very vulnerable, to sort of abuse online, to sexual abuse online. And that's something that, as much as we are wholeheartedly excited about the potential for AI to help us reach populations that we're not reaching right now, that we desperately need to reach, we're also mindful of the potential downsides, and we're very careful about how we proceed. And those collaborations are the important way to do that, I think.
A very balanced approach, just helping us look at the opportunity on both sides of the coin. And Mr. Patti, I don't know if you want to get in here. And we're talking about inventions, interventions, some of the areas in which we can see improvements. Of course, when we talk about health, we're not only talking about or we are also talking about elements such as vaccinations when it does come to health for certain things. And I say this specifically just given the fact that better than I that in terms of the African continent, we import practically every single thing that we use to administer vaccination. So, and I just want to know, within or against the broader context of some of the inventions from technology, and against the broader context of some of the benefits of collaboration, how are you looking at that prism specifically for the African continent?
I think I'll answer your question again, going back to Anita's, being centered on the person. And trying to listen to what the person, for some of us, for the men involved in issues of women's health, you have a limit. You sometimes feel like you're an imposter because parts of it that you haven't had the experience directly. In the context of Nigeria, for instance.
Some of them you don't want the experience.
Well, I think that's true to say. But when we did a focus group with women in northeastern Nigeria and asked a simple question, you go for antenatal care, but you don't go for delivery. To understand we got really important insights, some of which is just lack of awareness and the assumption that you go to the primary healthcare center for ANC and not to come for delivery. So you go to someone else to deliver. So I think Anita's point is very important. Whatever technology, whether it's vaccines, whether it's SRH, commodities, whether it's for non-communicable diseases. I think keeping that reference point of the person, the woman, and listening to her needs and use that to deploy the intervention is going to serve everyone well to achieve the impact, but also to address the needs of the person with their own consent.
And when I say that to some of them you don't want to experience them, no, I won't disclose for the sake of anonymity, but there's a particular female that I'm very close to, and I can tell you that in these very snowy conditions, particularly for us as Africans, in the morning after getting prepared, she's sweating buckets. She's of a particular age, and there's not a lot of research particularly that is done in this area as well. So as I say, some of them you don't want to experience them, sir. But just being cognizant of time, and I suppose going into concluding remarks for everyone here in the room. an argument that has been made that progress has been made since this time last year. But I guess it's how do we continue the progress for when next we meet again, this time next year. So perhaps just your concluding remarks on call to actions that can be made in this space to accelerate the goal that we are ultimately trying to achieve.
So I mean, you started the discussion with the data, yeah, and also the how great it is, yeah, that the data have been collected, and I believe this is also how we should conclude, yeah, that in the end, I mean, it is how do we define success, yeah, and success is by improving the data. Yeah, and I think the more we are aligned on this, yeah, and not only on some sub steps like, I mentioned the topic of how many units sold versus how much impact generated, and not how many pilot projects implemented, but how many lives saved or how many breast cancers found earlier. I think this is really the topic, and I say this especially because, I mean, we are now in a world where maybe people are, nations tend to be very much about their own nation. Yeah? And when it comes to companies and NGOs, we are working horizontally in a way. Yeah? And it becomes even more important now to commit to targets together. Yeah.
Catherine, maybe some of your final words, just as you reflect again on what has been done, as we are in agreement that collaboration is what is needed, but just reflecting on the different sectors and the different competing priorities, how we can strengthen them in this environment.
Well, I think the message I would like to leave people with is we have 600 million adolescent girls in the world right now. And these girls are sort of magical if you get to see them. They still think that there's some potential for them in the world. And too often that is crushed. But if we can really protect these girls through decent healthcare, through education, the consequences and the benefits to their societies is massive, right? And it is really something that I would really plead with people to keep in mind, because often these girls do get left behind. They drop out of school. The minister knows this better than anybody, that these girls are very vulnerable, and if we don't take care of them, we can lose them. But if we do take care of them, and if we all come together, if we bring the data and the leadership and the technology and the innovation together and really think about how to make their lives better, they will be stronger, healthier women, their children will be healthier, their societies will be healthier, and the consequences of that are great for everyone. So I would just say, don't forget these girls, please.
Wonderfully put. Thank you, ma'am. Mr. Pate?
Yes, there has been progress, but it's not enough, not nearly enough, I would say. And to go forward, better data to guide, to understand better, knowledge to be shared as to what works, what isn't working, and how to improve, the capacity or capability to take action at different levels in countries. And the voices of advocates, I think, needs to be continued. I think technology, innovation, AI, but in a way that also serves the interest of those who are intending to serve. And I will say financing to take those actions to improve access, to deal with financial protection, whether it's health or whether in the other sectors that are relevant, whether it's adolescent health, sexual reproductive health, to ensure that we continue to build on this initial progress. But it's not nearly enough, I would say.
Certainly. Anita, last but not least, and I know that we just touched on the Women's Health Impact Tracking Platform. We didn't go deep into it. Feel free, perhaps, as you do conclude, as to what you would like to see this time next year when we meet.
Yeah, so First of all, I really appreciate the comments that the other panelists have made on like what's important, what we need to do. And I think holding ourselves accountable to a lot of the things that have been mentioned is really important. That is the success of this coalition. So I was very happy to see, because I was pushing on this, like I'm the board co-chair for the Global Women's Health Alliance, that how are we going to measure success? And so they have come up with this impact tracker that they launched this morning that will measure progress. And if we don't succeed, all of you will know.
Yeah.
So we have to succeed, is how I would put it.
No, fantastic, and a fantastic tool, certainly to hold yourselves and all who are in the industry accountable. Ladies and gentlemen, thanks once again to all of you for your time and for your active participation as audience members. I hope that you were able to tell by our jovial mood that it's not the time of the month, but nonetheless, it has been wonderful to be here with you. Thank you, and the same to our online audience. Thank you.
Thank you.